Lorraine, welcome to the CIO Zone.
Thank you. Good morning.
So tell our viewers a little bit about your role with IBM and your company.
I am the Global Healthcare Ambassador, which means in my role, I will work with customers, strategic partners, and industry groups throughout the world to really talk about the trends that are happening in healthcare, what it means to me as a consumer, because we're now going to have electronic data, what it means to the healthcare provider, the value electronic data brings to them, and then working with the industry groups, because obviously change doesn't happen overnight. Change happens with a solid foundation from vendors and trade organizations and standards organizations, because healthcare is global, as we all know.
Tell us a bit about your company and what products and services that you offer.
Initiate is a company that was acquired by IBM in March earlier this year. And what we provide to the IBM suite of healthcare products is a product called IBM Initiate Patient, which helps the matching of patient records across disparate databases. IBM Initiate Provider, which helps you manage the identification and the linking of records around who the provider is. And a provider can be a lot of different, can be a physician, can be a pharmacist, can be an organization. So that gets very complex in and of itself. And then we have IBM Initiate Exchange, which is our solution around integrating and sharing and connecting records, particularly in the U.S., very high market now for sharing information from perhaps the community hospital or academic medical center out with the community physicians or the affiliated physicians, so that truly the records that are created in a hospital can then be electronically sent to that community physician, so they have it there to provide better care for the patient.
Rather than try to get everyone everywhere to adhere to a standard, otherwise you can't plug in, you've essentially eliminated that by building all those adapters, if you will, into the middleware that allows Initiate to connect to these disparate sources of information, irrespective of what formats they are. I suppose there are some limitations, but by and large, you can connect to most anything that's of some standard out there.
That is absolutely true, and we do it rather seamlessly with what some might call our appliance. So it goes out to the physician's office, it's shipped to them, they plug it into the electricity, it doesn't rely upon anything else out there really, and it makes it very easy for physicians, whether they already have an electronic record, whether they're paper-based and they're going to use us, to print maybe portions of the record that are out there. So we make it easy for the physicians to adopt and adapt, you might say.
With this kind of approach, you're really opening up access as required, in essence, information on demand, as we say here at this conference, pretty much globally, and wherever you have internet access. If you have an emergency in a foreign country, presumably they can get access to this information and use it and not have to wonder what you're allergic to, for example.
The value of creating that electronic record and then sharing it with all the providers across the vast continuum of care. I mean, to the consumer, I pay less perhaps in my co-pays. I don't have an extra needle stick because you have access to something that was done a couple of days ago.
And filling out all these forms over and over again?
Forms, the radiology tests that are redundant because the provider doesn't have access to something that was done a week or a month ago, so you're saving me radiation. I mean, it's tremendous, the value of sharing electronic information can have.
Of course, another very sensitive area when you're dealing with personal health records is privacy.
Absolutely, because you're not leaving security to chance. You've taken care of it with that appliance approach because you're not putting a lot of demands on that physician's office. The physician, the support staff that physician may have in there, they can rest easy.
Well, again, that seems to be in the spirit of the express route to compliance, governance, and functionality without depending upon changing all these systems and human behavior all over the place and making that a dependency before you can actually achieve this.
Transformational change to healthcare is tough. We all know that. It's an industry that's one of the last to really come into the age electronics and computers. So whatever you can do to make it easier and gain adoption, manage the privacy and security, very important.
Getting those appliances out there and building in the protections and whatnot, and making that a simple way to get people into the system without having to change them a lot is actually an important lesson to be learned for anyone who wants to roll out quickly.
And there's so much at stake right now in the U.S. for adopting quickly because of all the meaningful use payments. So, people want to be ready to meet that meaningful use criteria and using the systems and exchanging the data in order to get those incentive payments from CMS and from the states.
Do you have any interesting illustrations, success stories, if you will, of how this has worked in real life?
We have a number of clients, you're right, from the small end, the very small physicians' offices, to the very high end that are the large tertiary care facilities. With shipping the appliance, training the staff, the nominal amount that needs to be done, people can be up and live in 90 days or less on this. So time is going to be the enemy in 2011 of everybody.
Yes, the sands are running through the hourglass, indeed.
Yes, they are. Yeah. So whether you're the small office, which is you and I talked about, is 1 to 5 physicians, the majority in the U.S., or you're the large academic medical centers, large integrated delivery systems out there, quick adoption is important, but you got to do it, as you mentioned, with security and privacy. You've got to be scalable because healthcare is certainly changing in the years to come with everything we're hearing about patient-centered medical homes, with accountable care organizations, the regulations that are going to come. So a lot of factors that the healthcare providers have to manage today.